Protect yourself from kidney failure. Say goodbye to back pain. Join us for Diabetes Prevention Day. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. It's a busy March as we recognize a number of health awareness months and days. We have important information that can keep you at your best. March is National Kidney Awareness Month. And what you probably don't know is that 1 in every 6 African Americans has signs of kidney disease. And this same group of people account for 32% of all new cases of kidney failure. Here's what you need to know to protect your kidneys.
Yeah.
Okay, your blood pressure is actually looking very good.
People most likely to have kidney disease are people who have diabetes mellitus, hypertension, and there are some problems where people can have autoimmune diseases or other more rare forms of kidney disease. In diabetic patients, what usually contributes to kidney damage are changes to the blood vessel walls because of the high sugar levels in the blood. Normally, the blood vessels are very nice and soft and able to accommodate changes in blood pressure depending on whether patients have low blood pressure or high blood pressure. But what happens with diabetes, the excess sugar causes the proteins to become less elastic, and it damages the blood vessels and allows them to leak protein into the urine. The really unfortunate thing about kidney disease is usually people don't develop symptoms until it's too late. They'll work as hard as they can to the very end, and when they start screaming, please, 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 it's too late.
Diabetes is a major risk factor for kidney disease. Join Sinai-Grace Hospital on March 26th for the free Diabetes Alert Day Health Fair. Join us for great information and resources, free blood pressure and glucose screenings, cooking and exercise demonstrations. That's noon to 4 on Main Street. With spring right around the corner, it will soon be time to get up and moving outside. Don't let your back pain keep you from doing the things you love.
This is the slip set.
Back as we age is something that's something like getting gray hair, something that happens to all of us. And what happens is that there are different structures in the spine that start to degenerate in sort of a predictable fashion. One would be the disc of the spine, and that's something that tends to get less hydrated or loses its water content as we age, and as a result it tends to lose its height. There are some other things that happen as a result of that. Usually the foramen, where the nerves come out and go down into our arms and legs, depending on where you're at in the spine, tends to collapse a little bit because the disc isn't there supporting it like it used to be. Also, the ligaments tend to become lax, and we often see a situation where one vertebra moves forward on another. That's called a slip disc for a layman's term. Spondylolisthesis is the horrible name that we give it as doctors, but the slip disc is what people usually refer it to. Another thing that can happen with the spine as we age is that the joints will sort of develop wear and tear type changes. People are very knowledgeable about arthritis in the knee or the shoulder, where they sort of get little deformities and things like that. But you have to remember that the spine has multiple joints in itself. There's one at every level in the back, and there's one on either side. So joint problems are very common when it comes to an aging spine. There's not one best procedure for everyone. It also has to do a little bit with surgeon preference. Some surgeons have more success with some procedures over others. There are approaches for the lumbar spine, for example, that go through the belly to get down to the spine. There are some procedures that go from the side of the abdomen to get down into the spine, and then there are traditional open procedures that we do from the back, and those are the ones that folks are probably most familiar with. And in the cervical spine, very similar. There are procedures that we do from the front as well as the back. There aren't many side procedures at this point, but someone who comes in with a slip disc, as we talked about earlier, likely needs a fusion procedure of some sort. But again, it's all elective, and it's all a negotiation between you and your surgeon.
For more information on back pain, join us for our People's Medical College on March 30th. Our orthopedic expert will be on hand to talk about how you can get relief today. Call 313-966-4800 to register for this free class. This March, we are recognizing social workers. These healthcare workers like to say they are a profession of hope because every day they're changing lives.
We need to get
physical therapy and here in Sinai-Grace Hospital, in the hospitals, we're medical social workers. We all have graduate degrees in social work. We work with the patients and the families in a psychosocial evaluation kind of sense, where we assess what the patients and the families need as far as discharge planning, resources, outreach to the community, and whatever services we can help the patients and the families with. We have social workers in every area of the hospital, starting in the emergency department as well as on the units, including our OB and NICU area. We also are here on the weekends for discharge planning and new assessments of the patients. We work based on consults, so when you say services, it's more of not so much a service, but what we can do to help the patients transition from here to home or here to a facility. So we work with patients in the sense of discharge planning, whether it be home with home care, to a facility for rehab, referring them to community resources, getting them and their family better connected with services in the community. We work, basically our objective, our goal is to provide every patient that we work with a safe discharge plan. We really do make a point to try to see every patient, even if we're not consulted. But I think that the patients that do get to have our time to help them facilitate from here to home or here to a facility usually does work for them better than probably those patients who don't have that intervention.
If you'd had an illness or trauma that left your face disfigured or scarred, Leslie Harding reports on a Sinai-Grace doctor that's giving hope to his patients.
To many of his patients, Dr. Jivaka Yapa is a miracle worker. After an injury or illness, he's transforming their looks, and they're thrilled with the results.
Okay, it looks really, really good. Okay. Did Dr. Kumar take
At Sinai-Grace Hospital, we treat a large variety of patients, from maxillofacial trauma patients to patients that are referred to us for just reconstruction of their mouth, and also reconstruction of jaws that were altered due to pathology such as cancer and tumors.
That's looking really, really good.
We want to give function and form back to our patients by the replacement of parts of their jaw, or mainly their teeth. Most of the patients we see have lost them due to either gum disease or dental caries, which in the city of Detroit accounts for about 25% of the people we see. The other patients are seen due to loss of teeth due to trauma and tumor and resection. It's important to replace teeth because of aesthetics, but more important, the health of the patient. A good diet is really important in managing diseases such as high blood pressure and diabetes. And in order to have a good diet, one has to have proper teeth. And replacing missing teeth is an important part of the management of these kind of diseases. What makes oral maxillofacial surgeons different than the average dentist is the ability to replace missing teeth by actually replacing the roots of the missing teeth. I get a lot of referrals from orthodontists that send me patients that cannot be corrected with orthodontics alone. That means they have either an open bite, they have a deep bite, they have a lot of problems with chewing because of the alignment of their teeth. And most of these cases can be treated with just orthodontics. However, in situations where there is a skeletal problem where the orthodontist can't bring the teeth into the proper bite, then jaw surgery is necessary. We usually do jaw surgery on patients anywhere from 16 years to 50 years, depending on what is necessary. The success rate is very, very high. Obviously, we don't do it for everyone. They have to be healthy and have to have a dysfunction that's worth treating it surgically. But overall, our patients are extremely happy because of not only improvement in function, but also aesthetics.
To make an appointment with Dr. Jivaka Yapa, call 248-262-9100.
Did you know that headaches are a common cause of emergency department visits? There are literally hundreds of causes of headaches. Many people throughout the course of their life will experience a headache, but things that you should be concerned about and that will require a visit to the emergency department are a headache that's more severe or intense in terms of pain than your usual headache, a headache that lasts for more than several days to a week in duration, a headache that's associated with fever, or a headache that was associated with any type of injury. Those all may be indications of a more serious process that's occurring and would require an emergency department visit.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. Also, log on to pagingdredie.wordpress.com for great health information. I'm Melanie Moss. Thanks for watching.